Hello, I'm Jonathan Clogston-Wilmot. Welcome to our Acupuncture-Points.org YouTube channel. Today I'm going to be talking about turmeric. Now, turmeric is curcumin. It's the stuff that we get in many Indian dishes, and I'll tell you how and when to take it, but more important, how and when not to take it. So, here's what I'll tell you. How Chinese medicine understands turmeric and the difference with ginger, how it has warming and moving qualities, and how moving quality is good unless there's what's called blood deficiency, and the dangers and how to take it. So, first of all, how Chinese medicine understands turmeric. Now, botanically, it's in the same family as ginger, and ginger is called shengjiang, which is fresh ginger. Now, turmeric is called jiang huang, which means yellow ginger, and this is the one that contains curcumin and which you buy to use in the dishes for curries and things. A little bit of history goes back, to the 1400 years in China. So they had it from the 6th century AD, and it goes back probably far, far further for Indian medicine. Both turmeric and ginger are yang. They have warming and moving qualities. But there's a vital difference. Warming herbs do what it says. They warm you, and in this case, they warm your digestion. If you add them to food, and usually you'll digest it better, even cold food. So also, if you have a cold type disease or cold type cold, the kind that you catch sneezing and coughing and so on, eating a warming food such as ginger or turmeric may help you produce heat to help boil it off, kill the bug. The thing about moving herbs is that they move blood around you, and that's great if you have what's called blood stagnation, and that's good if you have plenty of blood. Now, we've got a page on our website on blood stagnation and one on qi stagnation, and I even wrote a book on qi stagnation. There's lots about it in there. But that's all good as long as you have plenty of blood. If you don't have plenty of blood, in other words, if you have what's called blood deficiency, and that includes anemia from the point of view of Western medicine, then probably turmeric is not so good for you. Blood stagnation. Well, blood stagnation is stasis in Chinese medicine. By the way, we have a page on that too. And nearly always it follows from what's called qi stagnation, and you get that from emotional stress. And don't forget, we have a web page on qi stagnation. Blood stasis type pains are usually deep and stabbing, and they're worse in cold conditions, and they often come with inflammation, in other words, things like redness and pain. Being warming, neither of these herbs is good if you have too much heat in your system. For example, stomach heat, which might become with ulcers and burning pains when you eat things. So don't use them if you have heat symptoms like that, because these herbs are warming. Neither ginger nor turmeric helps the urgent smelly diarrhea you get on holiday. And as I said, many kinds of stomach ulcer. So people say ginger is good for your digestion. Well, yes, it is, but not if you've already got too much heat there. But if you get a hot rash, too, sometimes ginger can help it if it comes from qi stagnation, because the qi stagnation produces blood stagnation, and you have to see our website for more about that. Like any herb, the more you know about it, there are more tricks. However, basically, turmeric being more moving is not good if you have blood deficiency. So, if you're anemic, for example, you get dizzy on standing up suddenly, or maybe you get palpitations on exercise, or maybe blurred vision, if you suddenly stand up too fast, then I would say avoid it. There are many more symptoms of what constitutes blood deficiency on our webpage. And if there's blood deficiency, you probably need more vegetables, more natural oils, maybe some kinds of meat, and probably you need to see our page on blood building foods, because we have a whole page on that, and our recipe for Clogston congee. So, a bit more about this. Turmeric, curcumin in other words, via Chinese medicine may help Western conditions, Western medically defined conditions, like as a kind of blood thinner. But if you're taking other drugs for this, then don't take it. Be very careful of adding a lot of turmeric to your food if you already have blood thinners prescribed by your doctor, for example. They may be helpful for painful, red, inflamed and swollen conditions, if that's due to blood stagnation. Very red, itchy skin problems from blood stagnation also are helped by this. Similarly, severe headaches, also caused by blood stagnation. How to take turmeric? Well, in traditional medicines from India, in traditional recipes from India, read the recipe. They've got 2,000 or more years of experience. Use that. Don't make it up for yourself. But medicinally, that's slightly different. You should not exceed the recommended or suggested dose. And be aware that one dose makes very few changes, but regular, repeated doses will have an effect. Not necessarily noticeable at the time, but you should be alert to this. These become medicines or medicinally active if you take them repeatedly. So, there we are. Now you know what turmeric is, how it works, what it may help, and when not to use it. If you have been listening, thanks very much. Leave a like or subscribe to our page, or if you want to, you can comment on this or even ask a question in the box below. So, thanks very much. I'm Jonathan Clodson-Wilmot. Goodbye.